What up, y'all? It's the Morning Hustle with L'Oreal and Kyle Santillian. And yes, you already know, man, we are home in that $1,000 cash grab. But we're going to do something special, man. I'm trying to build up Kyle's community, right? Where we put a little focus on what's happening with nonprofit organizations around the country that are doing great things for our community. And today we have two people here that are representing the Black Heart Association. And we have Miss Tara Robinson and Mr. Frederick Robinson in the building. How y'all doing?
Doing good.
Awesome.
Yeah, so let's talk. Now, I'm seeing that your backstory is kind of crazy, but before we get into that, what is the Black Heart Association?
Maybe I'll let you take it.
Okay, so Black Heart
short
Association, the short version. So we are a nonprofit organization whose mission is to simply eliminate heart health disparities in Black communities.
Short version, right?
Short version.
Yeah.
Now, the reason that you guys do this because you had, Tara, somewhat of a traumatic situation, from what I understand.
Right.
You suffered 3 heart attacks in a week's period of time.
3 heart attacks over 3 days.
3 days, not even a
Yes,
full week.
not
3
even a full
days.
week. Mm-hmm. Correct.
Let's talk about that a little bit. Like, what led up to that, and what were you doing? Like, what caused it?
My symptoms started in November of 2013. My left arm and my neck went numb. Those were my first 2 symptoms, but I wasn't tying it into heart issues.
Okay.
Showed up to my doctor in January, told her, hey, my left arm is going numb and my neck is bothering me. And she was like, well, you don't have any other issues like diabetes, cholesterol, or blood pressure. Maybe you're just stressed out.
Yeah.
So I left her thinking that was it. I've always been stressed, so that could very well possibly be my issue, but she never connected the dots for me and say, well, your stress can lead to heart issues. And so I left her thinking every time I was stressed out, I needed to just do something to not be stressed out.
Right.
So woke up at 2:00, fast forward to April, woke up at 2:00 in the morning and told my husband something's wrong. I had all the symptoms of a heart attack patient, which was left arm numbness, neck bothering me, upper back, felt like I swallowed a big pill and couldn't get it down, and all these things were happening, and then I was sent back home.
Dang.
Then next day in my classroom, fell to my knees. It was happening again. Went back to the doctor because I was forced by my husband to go back.
Good job.
Yeah, good job.
Right.
Went back and forth with a cardiologist on keeping me or not. Because at this time I was adamant about staying because I knew it was different for my body.
Yeah.
And convinced her to keep me, released me at 11 o'clock on April 12th. At 4 o'clock, I was telling him it was happening again that same day.
So they did release you,
So
even
I
though
was
you were fighting to
released.
stay.
Even though I had the textbook symptoms, but they could not find anything based on their procedures or protocol. And he asked me, what do I want to do? I said, I just left the hospital. I just want to take a nap, and maybe whatever this is will pass. And he said, you don't get to die on me today. Got me back to the hospital. There, I learned I was having a massive heart attack. Went into sudden death during operation, went to heaven, came back here, and learned that I had 99% blockage in my left artery. That condition is known as the widowmaker. So it's been a whole journey, and because of this journey, I'm determined to make sure that our community they don't continue to die or be caught off guard like I was.
Yeah, I mean, first and foremost, glad Frederick was there to kind of force the issue. Like, no, we're going to make sure this gets checked out, number one.
Yes.
And it's interesting hearing your story. I had a conversation recently with my sister who was telling me, my sister, much smaller issue. She tore her Achilles. She went to the doctor, blah, 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 blah. And she was talking about the dosage of her medicine, right? Yeah. And I'll tie this into what I'm saying for you in a second. And she was telling the doctor, like, no, I need a stronger prescription because I can still feel what she wasn't supposed to be feeling. And she was just talking about the fact that a lot of times when she's trying to explain things to doctors, they don't take her serious, or they feel like she doesn't know what she's talking about. And then she's having this issue about doctors respecting Black patients, and when they're trying to tell them about what they're going through, and them not receiving it. And it sounds like that same thing happened in your situation. You're like, no, I need to stay because this is not right. And they force you to go home. So a couple of things that brings me to think, like, number one, like, is there a lawsuit there? Are you able to say, yo, I tried to tell y'all?
What I've learned through this journey is I look at the healthcare system a lot of times in alignment with the criminal justice system.
Yeah.
We fight a lot we know all the laws, right, when it comes to police pulling us over and all the things. But when we go into the healthcare system, we never want to think that someone will intentionally send us home to die. But that is exactly what we're facing. We're not being heard. We're not taken seriously. We have to jump through all these loops to get situations taken care of properly,
right.
And it should not be. Injustices inside of the hospital is a real thing that we face, especially in Black and brown communities.
Thanks.
And so we're definitely on a upward trajectory on really trying to take those issues to make them criminal,
Yeah.
right? Because if you send me home, that's a death sentence for me and so many others that don't get to speak. So I definitely think it is a huge issue in our community, and what we need to do is we have to definitely advocate for ourselves, and we definitely have to know how to navigate that journey in the hospital system.
Yeah, for sure. Speak up. If you feel like something's not right, speak up. Like, a lot of times doctors have suggestions, but that's not law. You know what I mean? They're not
Right.
the king in this situation. We got to still listen to ourselves.
You're exactly right. And when we talk about lawsuits, a lot of times, especially in states where I'm from, it's hard to sue.
Yeah.
And so unless there's a death. But many times we don't know those deaths are happening. So we do need lawyers to speak up to help us fight this battle, because we can find them in the criminal justice system. But whenever we try to go after, finding an attorney that'll help us fight for the calls we still get about being sent home
Right.
and having to go to different hospitals to get the best care, we're still trying to help find a lawyer that will help us help our community fight these
sure.
battles.
A lot of times, it takes tragedy or drastic situations to hit our doorstep, and that's when it becomes real for a lot of people. So our fight is to let people know that even if it's not your doorstep, it is your doorstep, because we're all connected. We're all family. And if it's happening to you and I can do something about it, or I can do something to make it better, and I don't, then I'm just as guilty as the person who caused the injustice.
For sure. Now, you said something else I didn't want to breeze past. You said, I died, I went to heaven, and then I came back.
And then I came back.
You have a clear recollection of going to heaven.
I do. And I will say to anyone out there that heaven is real, and I know that I'm back here to save my community. I know the call that's on my life. This is much like ministry to me. And so when I died, the nurse was from New Orleans. She was the only Black person that I seen going through during this ordeal. And she was there to reassure me that everything was going to be okay. But in that moment of her saying, "It's going to be okay, baby," I died and I transitioned to heaven. I knew I was there because, one, I could see my spirit self, and two, I had this peace. I wasn't worried about my children here. And for a mother not to worry about her children is serious. I wasn't worried about my children. I wasn't worried about my husband. I wasn't worried about anything on this side.
Yeah.
I knew exactly where I was. And so I went to 3 different hospitals, saw 3 different doctors.
In heaven?
No, back here. I'm lining it up for you. Not in heaven.
No, I didn't want you to
Not
skip
in
that
heaven.
part, right?
But there's power in 3. And
Yeah.
my whole journey, April 12th, all it was alignment, God showing me he was with me my entire ordeal. And so coming back here, we don't ever talk about it, but a lot of us have survivor guilt, because I didn't want to come back here after visiting heaven. You cannot want to come back to this world after being in peace over there. So, but heaven can wait.
Okay,
Because I have work to do here.
All right, so that's what it's all about. Your work here, the Black Heart Association. We talked a little bit about you guys advocating for patients, Black patients, to be heard and things of that nature. What are some of the other causes that you're taking on as part of the Black Heart Association?
So the first thing for us at Black Heart Association, we knew that our people did not know where they stood as it relates to their heart issues. So we made it a point to get out there during the height of George Floyd and COVID. We were out serving the people. We were in a Kia. We started in our Kia in the back of the truck. We were just doing blood pressure and glucose screenings, and just wanted to support those small struggling Black businesses during that time, or helping our people any way we could during protests. And so we continued, and I said, this is it. This is what we should be doing. We should be screening people all over the nation, letting them know that you're at risk or you're not at risk. So currently we're on a tour to screen 10,000 people across the nation for their LDL-C, which is also known as bad cholesterol. that can impact your heart health. And then we're doing a test called lipoprotein A, which tests the blood to see if you're at risk of ever having a heart attack or stroke. That particular test is not covered by insurance, but Black Heart is able to give it to our community for free. All our screenings are for free. We do A1C, we do cholesterol panel, and we do kidney checks plus the lipoprotein A.
Okay, that's dope. What do you guys make of, what do you see now? There seem to be a lot in recent years of athletes that seem to be passing away a lot sooner, heart conditions, things of that nature. Do you notice a trend there? Or are you feeling like this is what we're trying to prevent? Like, what are you seeing in that? Or do you have any thoughts on that at all, actually?
Well, I think the biggest thing is what it's showing us is that no one's exempt. Heart disease, heart issues have no discrimination between age, race, body size, socioeconomic status, education status. All of us are at risk, and all of us need to know where we stand. All of us need to make sure that we're touching the healthcare system, we're in tune with our bodies, and we are getting checked out. Because again, you think about these athletes and you automatically assume that they're in the best shape of their lives, yet we're seeing these incidents occur more and more often. So heart disease doesn't care, quite frankly. So the more we know, the more we can arm ourselves with information about our bodies, the more we can arm ourselves with information about our family history, the better we are prepared to try to avoid these situations, because the more information I have, that's ammunition to fight with. So, and that's our mission, to give people as much ammunition to fight this battle as possible.
If anybody wants to reach out to you guys at the Black Heart Association, how can they reach out to you, tap in with you, and get you to come visit maybe them on site?
We are, this tour that we're on is called Guard Your Heart Tour. So if you want to visit and see where we are, if you want to have us, if you feel like there's an event that we need to be a part of, guardyourhearttour.org. You can learn about where we're going to be and how to connect with us for the tour. If you're interested in any other thing, blackheartassociation.org is our website. And across all social media platforms, we are Black Heart Association.
All right. Appreciate you guys. Any last thing you want people to know before we wrap this up?
I want people to know that the reason why Black Heart exists is because heart disease is very real in our communities. I want you to know that we don't have to die for something that can be prevented. All we have to do is know where we stand. Use our doctors as a prevention and not as treatment. Go to a doctor you trust. And if you can't find the doctor you trust, go to another doctor. You have to just keep searching for that doctor that is going to work for you, because your insurance pays for them to take care of you. We expect 5-star service from every other place of business, but not our doctor. So that's the expectation going forward. You deserve to be here. Our community deserves to be here well.
All right. Love it. Love it. Appreciate you coming by today. Tara and Frederick from the Black Heart Association. The Guard Your Heart Tour is taking place right now. Make sure y'all tap in with them. And thank you for being part of Kyle's community today.
We are the Morning Hustle.